Hello everybody, I'm Camila from Brazil and I will present the work entitled Effect of Hysterectomy on Urinary and Sexual Functions of Women with Benign Conditions, a Systematic Review. There are no conflicts on interest. Hysterectomy is one of the most common gynecological surgery in women. Although effective for non-cancerous gynecological conditions, the hysterectomy might adversely affect pelvic floor functions, which may result in several disorders for these patients. So, based on that, we have one question. What is the prevalence of urinary and sexual symptoms between women after hysterectomy for benign conditions? We conducted a systematic search in 6 electronic databases from September 1 to 7, 2019 by 2 researchers in accordance with the Prisma checklist. For search strategies, combinations of terms only in English were used, as you can see below. The test search was limited to investigation of prevalence or occurrence of LUTs and sexual dysfunctions in women after hysterectomy for benign conditions. There were no limits regarding the publication period, and articles were excluded if they were duplicates and if they were not research articles. Included study design were randomized controlled trials and observational studies, and study participants required to be adults aged 18 to 65 years, submitted to hysterectomy for benign conditions, and which measured urinary and sexual symptoms. For comparison, studies comparing surgical techniques for treating benign conditions for assessing the onset of voiding or sexual dysfunction were also included. The JBI critical appraisal checklist for studies reporting prevalence data was used for bias risk evaluation of these studies selected. In this systematic review, we found 90 studies published between 2001 and 2017. The articles were analyzed through the JBI critical appraisal checklist, and we found that all 9 articles had a low risk of bias. The average age of the participants ranged from 41 to 60 years, and the main dysfunction investigated were urinary symptoms related in 7 studies. Voiding dysfunction and female sexual dysfunction related only in 2 studies. Among sexual and voiding symptoms, urinary incontinence and dyspareunia were the main dysfunctions reported in the studies. Most results refer to abdominal hysterectomy, including voiding the symptoms such as intermittence and incomplete emptying. In conclusion, based on the results obtained through this systematic review, it is important to highlight some points. 1. Urinary and sexual dysfunctions in hysterectomized women are frequent events. 2. The main reported disorders were urinary incontinence and dyspareunia. And 3. Additional research is needed in order to investigate the impact of these symptoms. Thank you.